Hello, this is Akram Jafar, and in this session, I'm going to deal with the anatomy of the lymphatic system, gross anatomy of the lymphatic system. The lymphatic system consists of organs, vessels, red bone marrow, and the lymphatic fluid. Actually, the lymph is similar to the interstitial fluid, and the term lymph means clear fluid. The lymphatic organs consist of the thymus, the spleen, the multiple lymph nodes, as well as the lymphatic nodules that are present in the wall of the small intestine or in the large intestine and the appendix and in the tonsils and many other places in the body. Lymph nodes were historically and still sometimes referred to as lymph glands, and this is due to their similar appearance to glands, but at that time, in the earlier periods of medicine, there was limited anatomical knowledge. That's why they were called lymph glands. However, now we know that lymph nodes are primarily filters for the lymph fluid, and they are centers for immune responses. They are not secretory organs. Yet, lymph nodes are small, rounded, bean-shaped masses of tissue, and usually they are found in clusters and might physically resemble the true glands, like salivary or thyroid glands. And when lymph nodes swell, like those lymph nodes here that are present in the neck, or the ones that are present in the axilla, or the ones that are present in the groin, like this one here, swell due to infection, for example, they will become like palpable lumps or knots. Lymphatic organs can be classified as primary and secondary lymphatic organs. The primary lymphatic organs, they provide environment for the stem cells to divide and mature into B and T lymphocytes. Primary lymphatic organs include the red bone marrow, which gives rise to mature B cells, and the thymus gland. Again, it's a primary lymphatic organ. And the thymus gland, it's the site where pre-T cells from the red bone marrow, they mature, and hence they are called T cells, referring to their maturation in the thymus. The secondary lymphatic organs, they are the site where most immune responses occur. They could be either encapsulated, that's to say they have a connective tissue capsule, like for example here, this is a lymph node. You can see the connective tissue capsule, and the spleen, again, it has a very well-defined connective tissue capsule, even with some smooth muscle fibers in it. So these are encapsulated secondary lymphatic organs, and then we have the non-encapsulated ones, and they are called the lymphatic nodules, like those nodules that are present underneath the mucous membrane of the posterior third of the tongue, called the lingual tonsil. These are the lymphatic nodules that are present in the submucosa and the mucosa of the appendix. Well, they are non-encapsulated in that they are not covered by a connective tissue capsule. The lymphatic system has several functions. First of all, it's draining excess interstitial fluid. So in this respect, it is closely related to the cardiovascular system because it is going to return the lymph back to the venous system. The second is that it transports the dietary lipids and lipid-soluble vitamins from the GI tract to the blood, and there are special lymphatic vessels or capillaries called the lacteals. And the third is that the lymphatic system facilitates immune responses. It recognizes the microbes or abnormal cells and responds by killing them, either directly or by secreting antibodies from B lymphocytes that will cause their destruction. So the lymph is drained from the interstitial spaces by lymphatic vessels. It will circulate and go back to the venous system. It starts as lymphatic capillaries. These capillaries, as you can see here, they are not like the capillaries of the cardiovascular system. These capillaries are closed-ended tubes, and they are present in the spaces in between the cells. The lymphatic capillaries are present throughout the body, except in avascular tissue, for example, the cartilage, the epidermis, and the cornea. They don't have blood vessels, they don't have lymphatic vessels. And these lymphatic capillaries have greater permeability than the blood capillaries. That's why they can absorb large molecules as proteins and lipids. That's why we mentioned here that one of the functions of the lymphatic system is to transport the dietary lipids. Now, how come that these lymphatic capillaries have greater permeability than blood capillaries and absorb large molecules? The reason is that their structure is designed to let tissue fluid in but not out. And this is achieved by the presence of these anchoring filaments, which will keep the tube from collapsing under outside pressure. These anchoring filaments are located in between the cells of the tissue. So when there's increase in interstitial fluid here, then these filaments will pull on the wall of the capillaries and will prevent the collapse of the capillaries, although they are very thin-walled. And the second thing, as we can see here, that the endothelial cells lining these capillaries, they overlap each other, so they can act as like a one-way valve, allowing fluid to go in, but not allowing fluid to go out. In the small intestine, lymphatic capillaries, they carry dietary lipids into the lymphatic vessels, and the presence of these lipids will cause the lymph that is drained from the intestine to appear creamy white, and it has a special name. It's called chyle. Elsewhere in the body, as we said, the lymph is a clear, pale, yellow fluid. In the core of the villus of the small intestine, you can see a lymphatic capillary which has a special name called the lacteal. Lacteal because it contains a fluid that looks like milk. Lact means milky, like in lactose, for example. Now, lymphatic capillaries, they combine to form lymphatic vessels, and these lymphatic vessels, they are so closely resembling the veins in that they have a very thin wall, even thinner than the wall of the vein. And in addition to that, similar to the vein, they also have valves. These valves are allowing the lymph to go in one direction. So it goes up toward the termination, towards the neck, but will prevent the lymph from moving back. Lymphatic vessels are either superficial lymphatic vessels that drain the skin and everything superficial to the superficial fascia. They follow the superficial veins. In addition, there are deep lymphatic vessels which drain the deeper tissues and the internal organs, and they accompany the arteries, not the superficial veins. Lymphatic vessels will collect to form the trunks, and these trunks will unite to form the ducts. For example, here we can see that there is a jugular lymph trunk which drains the lymphatic vessels of the head and neck. There is a subclavian lymph trunk which drains the lymphatic vessels of the upper limb. There is a bronchomediastinal lymph trunk which drains the lymphatic vessels from the thorax. And of course, there are lymph trunks in the abdomen. As I said, that these trunks will unite to form the duct. So we have two lymph ducts. We have a right lymph duct, which is a very short one. It drains the right upper quadrant of the body. That's to say the right side of the head, the right arm, and the right chest. And the right lymph duct is a very short trunk, as I said. It opens at the junction of the internal jugular vein, right internal jugular vein, and the right subclavian vein. This angle here is called the venous angle, whether on the right side or on the left side, but the right lymph duct opens here on the right side. And by this way, the lymph is carried to the venous system, and by this way, the lymphatic system acts as part of the cardiovascular system. The other duct is called the thoracic duct. This is actually the largest lymphatic vessel in the body. Actually, it begins in the upper abdomen as an elongated sac which is called the cisterna chyli. Cisterna means sac, and chyli for the chyle, because it contains the lymph trunks that carry the lymph from the intestine, which is in the form of chyle. This thoracic duct drains the upper left side of the body and the entire body below the diaphragm. So don't be confused if someone asks you about the lymphatic drainage of the right lower limb. It will be to the thoracic duct, but the right upper limb will be to the right lymph duct. Again, this thoracic duct opens at the venous angle on the left side after it joins the other lymph trunks, the jugular lymph trunk, the bronchomediastinal lymph trunk, and the subclavian lymph trunk. As I said, that the lymphatic system consists of lymphatic vessels, which are either in the form of lymphatic capillaries or lymph vessels or lymph trunks or lymph ducts. The second part of the lymphatic system is formed of lymph nodes, and these lymph nodes are present along the lymphatic vessels. They, as I said, they are not glands. They filter the lymph and they receive lymph from multiple afferent lymphatic vessels. You can see them here. Note the valve that allows unidirectional flow of lymph. And at the hilum of the lymph node, it will give rise to one or two efferent lymphatic vessels, again with valves that allow unidirectional flow of lymph. So while the lymph is passing through the lymph nodes, it will get filtered, and because the flow through the lymph nodes is very slow, the cells that metastasize from primary tumors will have the tendency to lodge and grow as secondary tumors in lymph nodes. Some of these lymph nodes are abundant and accessible to palpation, like for example in the axilla, in the groin, or in the neck. And you can see here the palpation of cervical lymph nodes. However, other lymph nodes are located deeper in the body, like in the thorax or in the abdomen or in the pelvis, and can only be detected by methods such as imaging or endoscopy. Like for example here, you can see the enlarged lymph nodes in this axial CT, showing enlarged lymph nodes in relation to the abdominal aorta. Right. Now, why are we interested in the routes by which lymph flows from different regions of the body? We are interested in this because knowledge of these routes is essential to understand the lymphatic spread of infections as well as cancer. Now remember that we said that the lymphatic system consists of lymphatic vessels and the lymphatic organs, and the lymphatic organs are primary or secondary lymphatic organs. We dealt with the lymph nodes. Now I will deal with the spleen as another lymphatic organ. In fact, the spleen is a secondary lymphatic organ, and it lies in the left upper quadrant of the abdomen, or in the left hypochondrium to be specific, when we divide the abdomen into 9 regions. In the Middle Ages, the spleen was believed to be the source of black bile, one of the humors of the body, also called melanchol or melancholy, lying under the costal cartilages. Under means hypo. The costal cartilage is chondro. So the region is called the hypochondrium, and it has been considered, because of that, as the source of undue concern about health, which is called hypochondria. That is the origin of hypochondria. It's related to the spleen, which is located in the hypochondrium, beneath the costal cartilages. Of course, these have nothing to do with science, but this is how medical terms originate. Now, the spleen has a delicate nature. Because of its delicate nature, severe blows might cause rupture of the spleen, even if the blow is not direct on the spleen, but it might rupture. The spleen might be injured and rupture, particularly if the overlying ribs are fractured. As you can see here, that the spleen is related to the 9th, 10th, and 11th rib. So it is located above the costal margin. This is showing ruptured spleen. When the spleen ruptures, it cannot be sutured, and it will be the source of a very severe bleeding and should be treated by removal of the spleen, splenectomy. Because the spleen does not extend inferior to the left costal margin, so it is not palpable, the normal one, unless it is enlarged. And it should be enlarged to approximately 3 times its normal size to be palpable. When it is enlarged, the spleen has a special characteristic here, is that the superior border of the spleen, which will come to become, when the spleen is enlarged, will become anterior, is characterized by a notch. And this will be helpful when palpating an enlarged spleen and finding a mass in the abdomen. If it is notched, then it indicates that it is an enlarged spleen. The last organ, lymphatic organ, which is actually a primary lymphatic organ, is the thymus, and the thymus is located in the mediastinum, in the superior mediastinum, most anterior part of the superior mediastinum. It might extend into the anterior mediastinum, and relative to adjacent structures, it appears as its largest about the time of birth. You can compare between the size of the thymus of a newborn and the size of the heart here. As you can see that the thymus is very big in comparison, but in the adult, the thymus atrophies and will be gradually replaced by fatty tissue, but it is still functioning. The thymus is not only part of the immune system as a primary lymphatic organ, but it is also considered as part of the endocrine system because it produces hormones that are required for the nurturing and maturation of the T lymphocytes. The name thymus possibly comes from the herb thyme, and because of the resemblance of the leaves of this herb to the shape of the lobes of the thymus, especially when in a newborn, where the thymus is in its largest size. So let's start with studying the lymphatic drainage of different parts of the body. I will start with the lymphatic drainage of the lower limb.